Basic Nursing Skills Practice Test for the CNA. To obtain the most accurate patient weight, the nursing assistant should weigh the patient. A. With 2 different scales. B. 3 to 4 hours after eating. C. Directly after a meal. D. At the same time every day. The correct answer is D. At the same time every day. Weighing the patient at the same time every day will yield the most accurate results, as the patient is likely in similar circumstances. A nursing assistant is instructed to take the oral temperature of a patient who just had a cold drink. The patient's temperature should be taken. A. Immediately, a cold drink should not affect the reading of most oral thermometers. B. 3 to 5 minutes after the drink was finished. C. 15 minutes after the drink was finished. D. 20 to 30 minutes after the drink was finished. The correct answer is C. 15 minutes after the drink was finished. A delay of 15 minutes should be enough time for the oral cavity to return to a more accurate body temperature. A nursing assistant is caring for a patient with MRSA and is wearing a gown and gloves whenever she provides the patient care. When she needs to go care for another patient, she should dispose of her gown and gloves. A. In the next patient's room before touching that patient. B. In the dirty utility room. C. In the current patient's room. D. In the hallway. The correct answer is C. In the current patient's room. Taking the gown and gloves off in the patient's room before leaving to care for another patient helps reduce the spread of infection to staff and other patients. Another term for decubitus ulcer is A. Perforation. B. Ulcerated cyst. C. Pressure sore. D. Ulcerated tumor. The correct answer is C. Pressure sore. The term pressure sore is actually a more accurate term to use than decubitus ulcer. The other options are incorrect. When monitoring a client's temperature, which thermometer will provide the least accurate reading? A. Tympanic. B. Axillary. C. Oral. D. Rectal. The correct answer is B. Axillary. Axillary and skin thermometer readings are the least accurate among temperature devices. The most accurate thermometer reading will come from a rectal thermometer. This is followed closely by oral, tympanic, and temporal thermometers. When transferring a resident from a wheelchair to stationary chair, the nursing assistant should stand. A. In front of the wheelchair. B. To the left of the side of the wheelchair. C. Behind the wheelchair. D. To the right side of the wheelchair. The correct answer is A. In front of the wheelchair. Standing in front of the wheelchair is the most ergonomic way for the nursing assistant to pivot a resident into a stationary chair. The other options are not as effective for allowing this. Which of these could be considered neglectful when assisting a resident with showering? A. Leaving the resident alone so they are motivated to care for themselves. B. Being sensitive to water temperature and testing it before beginning the procedure. C. Respecting the fact that bathing and showering can be a scary activity for residents and assuring them you will help them through the process. D. Being patient and calm and explaining what you are going to do before you do it. The correct answer is A. Leaving the resident alone so they are motivated to care for themselves. Residents left alone in the shower could slip and fall. Leaving a resident alone is considered neglect. All of the other options show care for the patient and her rights. A resident suddenly complains of chest pain and shortness of breath. What should the nursing assistant do first? A. Encourage the resident to take deep breaths and continue with the activity slowly. B. Leave the resident alone to rest quietly. C. Call for the nurse or emergency help immediately. D. Help the resident lie down flat and give them a glass of water. The correct answer is C. Call for the nurse or emergency help immediately. Chest pain and shortness of breath are possible signs of a heart attack or another serious cardiac or respiratory emergency. In such situations, immediate medical attention is critical. As a nursing assistant, your first responsibility is to recognize the emergency and get help right away. Delaying could endanger the resident's life. All of these are ways to prevent pressure sores except A. Changing soiled sheets quickly. B. Avoiding wrinkles in sheets. C. Providing extra blankets. D. Changing positions regularly. The correct answer is C. Providing extra blankets. Providing extra blankets will not necessarily help with pressure sores. The other options all assist in pressure sore prevention. Which of these describes stage 4 of a decubitus ulcer? A. Redness on the skin. B. Open area with damage reaching to the bone, joint, or tendons. C. Superficial ulcer that looks blackened or like a deep crater. D. Open area with redness. The correct answer is B. Open area with damage reaching to the bone, joint, or tendons. Damage to the bone, joint, or tendons signals stage 4. Stage 1 is redness, stage 2 is both redness and an open sore, and stage May 3rd indicate a blackened or crater-like appearance. Which medical term is often used for burping, belching, and passing gas? A. Familial. B. Flank. C. Fascia. D. Flatus. The correct answer is D. Flatus. The medical term for intestinal gas is flatus. Familial refers to a condition more common in certain families than in the general population. Fascia is the medical term for a tissue lining under the skin. Flank is used for a side of the back. Making a bed, whether occupied or unoccupied, should end with A. Moving the call light. B. Washing your hands. C. Mitering the corners. D. Adjusting the height of the bed. The correct answer is B. Washing your hands. Hands should be washed after making the bed. The other options are part of the process but not the last step. Which of these is least likely to contribute to skin tears? A. Equipment. B. Length of nails. C. Length of hair. D. Resident falls. The correct answer is C. Length of hair. The length of a resident or caregiver's hair is the least likely element to cause a skin tear. The other options are all considered common causes of skin tears for both the elderly and the very young. Which of these treatments would be best to decrease swelling? A. Dry bandage pressure. B. Cold compression. C. Heat compression. D. Moist bandages. The correct answer is B. Cold compression. Cold packs are applied to reduce swelling. Heat compressions are common treatments for back pain. Dry bandage pressure is used to stop bleeding and moist bandages are used on burns. Which of these is the least likely to signal impending death? A. Unstable blood pressure. B. Cooled extremities. C. Increase in appetite. D. Labored breathing. The correct answer is C. Increase in appetite. Impending death will often lead to a decreased appetite rather than an increase in appetite. The other answer options are all common signs of a body shutting down. Which medical position can be described as, the patient's head is elevated with legs either bent or straight? A. Trendelenburg's position. B. Rose's position. C. Sims' position. D. Fowler's position. The correct answer is D. Fowler's position. In Fowler's position, the head is elevated. In Trendelenburg's position, the head is lower than the feet. In Sims' position, the resident is lying on one side. In Rose's position, the head is over the end of a table. Which of these examples demonstrates using proper body mechanics when helping to lift a resident in bed? A. Bending at the waist, knees unlocked, using back muscles to lift. B. Bending at the waist, knees locked, using arm muscles to lift. C. Bending at the waist, knees unlocked, using arm muscles to lift. D. Bending at the waist, knees partially flexed, using leg muscles to lift. The correct answer is D. Bending at the waist, knees partially flexed, using leg muscles to lift. Keeping knees flexed and using leg muscles to lift are the best options to avoid injury. The other options are not using body mechanics properly and increase the likelihood for injury. The best use of alcohol-based sanitizer is A. When hands are not visibly soiled. B. When helping with catheterization. C. When hands have blood from a cut. D. When hands are visibly soiled. The correct answer is D. When hands are visibly soiled. Alcohol-based sanitizers are best used for hands that are not visibly soiled. Soap and water are used when soiling is visible. The other options are not appropriate times to use alcohol-based sanitizer. Which of these is incorrect in reference to wearing gloves? A. Peel the glove away from you so it comes off inside out. B. Wash your hands before putting on, and after removing, gloves. C. Always wear latex gloves because they are the most impermeable option. D. Upon removal, avoid letting the outer layer of the gloves contact your skin. The correct answer is C. Always wear latex gloves because they are the most impermeable option. Latex gloves may not necessarily be the best choice because of latex allergies. The other options are all necessary precautions that should be used. If you are walking with a resident and they fall, which of these is not an action you should take? A. Inform the nurse. B. Help the resident off the floor and into the nearest chair. C. Keep the resident from moving until you can assess if they have injuries. D. Supply information for the nurse so proper documentation can be made. The correct answer is B. Help the resident off the floor and into the nearest chair. Helping the resident off the floor and into the nearest chair is not an immediate action to take. A serious injury might become worse if the resident is moved. The other actions are all necessary in the process of dealing with a resident who has fallen. If you smell smoke and discover a resident smoking in his room, it is best to A. Ignore the first incident but report it if it happens again with the same resident. B. Call the family contact and ask them to deal with their loved one on this issue. C. Tell the resident you will allow him to finish his cigarette but you are obligated to report it if it happens again. D. Have him stop and remind him of the facility policies because of the hazards it creates to every resident. The correct answer is B. 8 ounces can of juice. The resident needs to stop and to know you will not allow his behavior to continue. He also may need to be reminded of the policies and hazards. The other options are not the proper way to immediately deal with the situation. A resident is supposed to have 240 milliliters of juice every 2 hours. Which of these choices would be the most convenient to meet this requirement? A. 4 ounces can of juice. B. 8 ounces can of juice. C. 5 ounces can of juice. D. 12 ounces can of juice. The correct answer is B. 8 ounces can of juice. The resident needs 240 milliliters, ml, of juice every 2 hours. Since 1 ounce, Oz, equals 30 milliliters, we convert 240 milliliters divided by 30 is equal to 8 ounce. 240 ml divided by 30 equals 8 ounces. The 8 ounces can provide exactly 240 milliliters, making it the most convenient option. The other choices would require measuring or partial servings, making them less convenient. All of these might be used in dealing with contractures except A. Physical therapy. B. Bandaging. C. Repositioning. D. Hand roll. The correct answer is B. Bandaging. Contractures involve the degeneration and stiffening of joints. Bandaging is not used as a method of prevention or treatment. The other options are all possible ways of preventing contractures from happening or loosening joints after contraction has occurred. Hypertension is a medical term for A. Hyperactivity. B. High blood pressure. C. Tense muscles. D. High anxiety. The correct answer is B. High blood pressure. The medical term for high blood pressure is hypertension. The other options are incorrect. To minimize the spread of bacteria, further infection and contamination, which procedure should be used for washing the perineum of a resident with a catheter? A. Wash from the rectum to the meatus. B. Wash from the meatus out. C. Wash from the rectum to the scrotum. D. Wash with peroxide. The correct answer is B. Wash from the meatus out. Washing from the meatus out is correct because it avoids further spread of contamination. Peroxide is not a cleanser and the other two options are in the opposite direction they should be in. Which of these should not be part of the process for cleaning a resident's dentures? A. Placing clean dentures on top of a tissue on the resident's table. B. Rinsing thoroughly. C. Patting the sink. D. Washing your hands. The correct answer is A. Placing clean dentures on top of a tissue on the resident's table. Placing dentures on a tissue could lead to dentures being knocked off and damaged, or a housekeeper removing the tissue and, inadvertently, throwing the dentures in the trash. The other options are extremely important to the washing process. A resident in your care has called you for help. He claims he can't find his dentures. As a nursing assistant, it is your responsibility to A. Notify the supervising nurse. B. Document the loss in the patient's medical record. C. Tell the resident that you will notify the family contact member. D. Ask the resident to refrain from eating until the dentures are located. The correct answer is A. Notify the supervising nurse. The supervising nurse should be notified. He or she will determine the appropriate documentation of the incident. It is not a nursing assistant's role to contact the family members or make a decision that the resident should stop eating. Applying friction in the hand-washing process is very important. According to CDC recommendations, the scrubbing portion of hand-washing should take A. 20 seconds. B. 10 seconds. C. 60 seconds. D. Any amount of time, as long as you scrub until hands feel clean. The correct answer is A. 20 seconds. 20 seconds is the suggested recommendation for proper friction. To make sure you are scrubbing for the correct amount of time, it is often suggested you sing or hum Happy Birthday to yourself twice while washing. All of these precautions should be followed when using a transfer gate belt, except A. Never using a frayed or worn transfer gate belt. B. Not worrying about proper body mechanics. C. Placing transfer belts around the resident's waist. D. Slightly rocking and pulling when using a gate belt on a resident in a sitting position. The correct answer is B. Not worrying about proper body mechanics. Proper body mechanics are always used to avoid injury and should never be ignored. The other options are all useful precautions. Which of these is considered an accurate method for counting respiration rate? A. The resident counts to 60 while the nursing assistant counts respirations. B. The nursing assistant counts to 60 while watching the resident's chest. C. The nursing assistant looks at the resident's chest and a watch at the same time. D. The nursing assistant watches the chest while the nurse looks at her watch to time 60 seconds. The correct answer is C. The nursing assistant looks at the resident's chest and a watch at the same time. The nursing assistant monitors a watch for a 60-second interval while observing the resident's chest. The other options could produce an inaccurate result. Note: previous standards advise to typically time the respirations for 30 seconds and 60 seconds if abnormal. More recent CNA information recommends timing all respiration checks for 60 seconds. Check with your nursing instructor for further information on this. The medical term tetraplegia, meaning paralysis of all four extremities, is often used interchangeably with the term A. Quadriplegia. B. Cardioplegia. C. Hemiplegia. D. Paraplegia. The correct answer is A. Quadriplegia. Quadriplegia is another word used for tetraplegia, both of which mean paralysis of all four extremities. Hemiplegia is paralysis of one side, cardioplegia is paralysis of the heart, and paraplegia is paralysis of just the legs. Which of these is not true when taking a blood pressure reading? A. The optimum position for the resident is sitting with both feet on the floor. B. It is best if the resident does not talk while his or her blood pressure reading is being taken. C. Blood pressure readings can be a little higher in the mornings. D. The optimum position for the resident is lying down with his or her feet elevated. The correct answer is D. The optimum position for the resident is lying down with his or her feet elevated. It is not optimum to have a resident lying down for a blood pressure reading. All of the other options are true considerations for optimum results. A resident has the following symptoms: dizziness, feeling faint, blood pressure below 90/60 and cold, sweaty skin. The resident is most likely suffering from A. Hypoglottis. B. Hypotension. C. Hypertension. D. Hypodermia. The correct answer is B. Hypotension. Hypotension is low blood pressure and all these symptoms are associated with it. Hypodermia is the medical term for tissue under the epidermis, hypoglottis is the underside of the tongue, and hypertension is high blood pressure. The CNA is assessing the pulse of a 9-year-old child. The CNA would expect the child's heart rate to fall within which of the following heart rate parameters? A. 90 to 140 beats per minute. B. 100 to 160 beats per minute. C. 70 to 100 beats per minute. D. 80 to 110 beats per minute. The correct answer is C. 70 to 100 beats per minute. The normal heart rate parameters for school-aged children are between 70 to 100 beats per minute. The parameters for an infant are between 100 to 160 beats per minute, for toddlers 90 to 140 beats per minute, and preschoolers between 80 to 110 beats per minute. Alcohol-based hand cleanser is appropriate for all of these situations except A. When soap and water are not available. B. After handling a resident's clothes. C. After walking a resident down the hall. D. When hands have observable dirt. The correct answer is D. When hands have observable dirt. Observable dirt that is visible on hands requires soap and water. The other options are all considered times that alcohol-based hand cleanser could be used. Which of these is not true about the proper procedure for taking a tympanic membrane temperature with an electric thermometer? A. Use a speculum cover that is twisted securely in place. B. Be sure the ear is free of cerumen earwax before inserting the unit. C. Wait for the unit to signal before removing the speculum. D. Be sure that the speculum fits snugly by pulling gently on the ear pinna. The correct answer is B. Be sure the ear is free of cerumen earwax before inserting the unit. Do not attempt to remove cerumen from the ear canal before taking a tympanic membrane temperature. All of the other answer choices are procedures that should be followed. If you are helping a resident put on a clean nightshirt and it falls to the ground before you get started, it is best to A. Ask the resident if they want to go ahead and use the dropped shirt. B. Put the shirt in the hamper for cleaning and get another clean garment. C. Tell the resident to wear the shirt until you can go and get a clean one. D. Place the shirt on the chair and go to get a clean garment. The correct answer is D. Place the shirt on the chair and go to get a clean garment. When a clean night shirt falls to the ground before a resident can put it on, it is important to prioritize hygiene and comfort by disposing of the fallen garment in the laundry hamper and promptly providing a fresh one. This approach prevents any risk of contamination from dirt or germs that might be present on the floor, ensuring that the resident's well-being and cleanliness are maintained. Convulsions are associated with A. A spasm. B. A tear. C. A seizure. D. A sprain. The correct answer is C. A seizure. Convulsion is a term often used interchangeably with seizures. The other options are all incorrect. When muscle tissues shorten and then a joint becomes hard to move, it is called A. A perforation. B. A twitch. C. A contracture. D. A rupture. The correct answer is C. A contracture. Contracture is the shortening of muscle tissue, making stretching difficult. A rupture is when something bursts open. A twitch is a sudden, jerking movement. A perforation is an opening. Which of these tasks related to intravenous therapy is in the scope of responsibilities for a nursing assistant? A. Watch the drip and report any problems. B. Get the intravenous feed into the patient and then call the supervising nurse to assess. C. Prepare the proper solution. D. Nursing assistants are not allowed to be involved in the intravenous process. The correct answer is A. Watch the drip and report any problems. A nursing assistant can watch the flow of solution and then report any problems to the charge nurse. The nursing assistant cannot start the feed nor prepare the solution.